Your heart, which is symbolic of love, needs love and care. Need to think about your own heart and save it. A normal cholesterol does not mean you are free from the risk. Cholesterol is only one of the risk factors. We all are interested in treatment after the illness. We are trained that way, tuned that way, and the whole system works that way. The earlier model was the government was taking care of the prevention, and the doctors were to intervene when there is an illness. Your heart, which is symbolic of love, needs love and care. You need to think about your own heart and save it from the deadly episodes like heart attacks. You know this man, Harriet would know, Siva of Aircel fame, who later sold the Aircel long before, decades before. Let's see what he has to say. He is not a doctor, he's a layperson.
The Indians' number one cause of death is heart attack, and it is totally preventable. You just take your APOB, keep it under 30 to 40. You will not get heart attack for 10 years.
He also reveals that he is not a doctor, and the doctors are not trained to prevent. And he is going to create a program which he claims, which will be used by doctors to prevent illness or promote wellness. So this is the realities that we are now facing. And we did make a beginning long since the introduction of the CT scans. In fact, the current approach is one of doing some blood tests, see your cholesterol, and then whatever little you can do towards the risk factors. The risk factors are many. And one test which will give you the telltale story of the status of your coronary is the imaging of the coronaries. Coronary artery disease, we call it, starts much earlier in life, and then unless you take note of it and take necessary steps to prevent, it will go on, and until you one day realize, after ignoring most of the symptoms like dismissed as gas, that one day you'll get a heart attack, to either succumb to it that moment or you suffer irreparable damage to the muscles, and which will reduce your quality of life and also quantity, of course. This is the picture of the artery. That's a artery where there is already some atherosclerosis going on. It starts in the wall. No test will reveal this except the test that I am referring to. The next step in the progression is that it starts in some places moving into the blood path, reduces the space. You don't get any symptoms here again until the block advances beyond 50%. Then while walking you might have. But the worst thing that happens is the third thing. The covering over that yellow deposit sometimes cracks. As much as a crack anywhere on your body, skin causes clots. The clot happens in a matter of minutes over this yellow plaque, we call it, and completely chokes the artery, resulting in a heart attack. Depending on where it is, it can be small or it can be big. But what instantaneously kills is that you get what's called as ventricular fibrillation. The heart simply stops, is not able to cope, and then you drop dead. But that is only a small percentage. The majority go through the course of the attack. You might go through an angioplasty, or you may not. You may go through medical management. Sometimes you don't go through anything because you dismiss it as gas, and then you suffer the long-term damage. And in the course of the next few days, you might succumb to it. But quite a majority, survives these episodes. That doesn't mean that you are cured of the ailment. You are only recovered from the heart attack. So this is the sequence of events which results in a heart attack and the consequences of the heart attack. So what do you do to take care of it? Know early. Know your risks early. And the one test which will give the telltale evidence of this particular lesion is coronary imaging, so-called calcium scoring it's called. It sounds a little confusing. What is this calcium doing? Calcium is deposits as part of the total plaque, which includes cholesterol. And the risk factors which results in this is many. Smoking, of course, diabetes, blood pressure, family history, and you have stress, which you can't avoid anyway. And then with the passing years, your artery get clogged. So a normal cholesterol does not mean you are free from the risk. Cholesterol is only one of the risk factors. There are many WhatsApp things which are coming up that cholesterol is normal component of the blood and you need cholesterol. All that is true, but raised cholesterol needs to be lowered to reduce the risk contributed by cholesterol. And normal cholesterol may still be, you can end up with a heart attack because other factors contribute to it. So while earlier one thought that the cholesterol is the only thing and you reduce the cholesterol or keep it lower below 200 is good enough, it is not good enough. If somebody has a heart attack or telltale evidence of this block, you try to lower it as low as possible, even to 100 level of 100 milligrams per deciliter. So this is the story of the development of the heart attack and the consequences of a heart attack.